Hello everybody, my name is Johanna and I am here to make a video. I'm actually doing this a little early, but who says I have to do it in February, right? I usually start around this time and I go through the month of February usually. But February is CHD Awareness Month, also known as Congenital Heart Defects Awareness. And throughout the month of February, I go on my social media accounts and I sent out information asking for retweets, tweets, or follows from famous people, friends, anybody that I can send the info to. I've had great responses and great feedback the last 2 years, so I'm hoping to do even better this year. My goal is to actually get retweeted by my favorite NASCAR driver. I don't know if that'll happen, but hey, maybe he'll come across this video as I send it to him. We shall see. But the reason why CHD Awareness Month is an Awareness Week is February 7th through the 14th. And remember to wear red during that week for someone you know who is a survivor or may have lost their life to it. So wear red. But anyways, the reason why CHD Awareness Month is so important to me is I myself, in fact, am a survivor and also a lifelong sufferer of CHD. The CHD, the congenital heart defect I have, is called Epstein's anomaly. It is a rare defect. It's a severe defect, if not one of the most severe defects. It was not known until the day after I was born, but when I was born, I was struggling, and my doctors told my family I had a 48-hour window to survive. Thankfully, I talked about it in previous videos. As you can see, I have battled through a lot. I'll kind of maybe explain a little bit about it in this video. I'm not sure yet, but I have battled through, and here I am 25 years later. I'll be 26 this summer. To see this far in my life is amazing, because every 1 in 100 children are born with a CHD, and I was one of those 1 in 100. And usually CHDs go undetected. Sometimes sometimes it's too late, and usually children pass and they don't know they had a CHD, or they don't even get to see adulthood. So for me to be one of those people that have seen adulthood is a blessing to me. But I have a little bit of information on my phone about Epstein's anomaly. I'm going to read it to you. I found this the other night, and I thought it was great information. You probably won't be able to see the picture. Probably not. Nope. Oh well. But what it just shows is what the defect, you can kind of see it, what the defect looks like. This is an Epstein's anomaly heart. So this is what my heart looks like, except it's got some hardware in there. But I'll just go ahead and kind of read this. I can't talk today. Statistics show that only 1 in every 21,000 live births gets to suffer from Epstein's anomaly. So that tells you this is an extremely rare defect, and I happen to be one of those 21,000 or 210,000 live births. Condition has an equal ratio for both females and males, so it's not, one or the other. It's equal between us. It's a condition that is hard to detect, and its symptoms are noticeable at any age. So I was showing symptoms immediately after I was born. I had cyanosis around my lips and struggling to breathe. So mine was detected pretty much right away at birth, but they could not figure it out fully until the next day when my cardiologist diagnosed me. Patients who suffer from this condition are hard to notice from the first look. Severe symptoms may not be seen at an early age, while minor problems may hide the symptoms till the teenage age. This is a very rare disease that involves the heart's right side. So it's the right side of the heart. It's a condition that may affect Caucasians, as research suggests. And of course, I'm Caucasian. So what is Epstein's anomaly? I'm sure a lot of people want to know, what does Epstein's anomaly mean? What is it? It's generally congenital malformation, which means you were born with it. It's a disorder that happens when the tricuspid valve that divides the two chambers of the heart doesn't make a normal function. What happens is that the tricuspid valve forms far down, this has a spelling typo in here, down the ventricle, making the ventricle to grow weaker and even smaller than its normal size. It involves one half of the tricuspid valve getting stuck on one side of the ventricle. This may in turn cause blood to move or leak on the wrong direction. So basically, there is no leaflet there, so blood just regurgitates into the chamber. Signs and symptoms may include, due to the tricuspid valve causing leakage or backflow of blood to the rest of the body, swelling may happen on the bellies and legs. I haven't really noticed swelling throughout my life. Sometimes I do, but difficulties in breathing to liver enlargement. My liver's been fine so far. They do check it usually yearly. I do have difficulty breathing. Again, that is part of my Epstein's. Leakages causing mixing of both deoxygenated and oxygenated blood that flows through the rest of the body. Blue coloring of the lips and fingers. This is referred to as cyanosis. So that is what was present on me when I was born. It's believed to cause strokes and brain tremors and damage of brain tissue. I haven't gotten there yet. I really hope that doesn't happen to me. That is why I'm on blood thinners, also because I have a mechanical heart valve. This happens when blood clots flow to the left ventricle. It can cause unrhythmic heartbeats that result to dizziness or even fainting. I have this frequently. I even have arrhythmia, atrial flutter. My heart skips or it stops a few beats. It's very annoying. Abnormal heartbeat may cause a victim to fall short of breath for some time. Yes. So what causes this disease? What causes Epstein's anomaly? How does it happen? It's believed to be genetically inherited or caused by environmental aspects that have yet to be proven by research. So basically, this is such a rare disease that nobody knows how it's caused. Research is still going. I don't know if they will ever figure out, but we'll see. But researching is doing its best to give answers to all these questions. What's the treatment for this condition? The treatment is dependent on defection of the heart, and normally for mild cases, certain kinds of surgeries may be required, and also antibiotics may be administered. In some cases, if too much blood backflows to the left ventricle, certain medications can also be administered that prevent strokes and heart failure. In critical conditions, surgery may be done, and I am a severe patient, so this has happened to me, may be done to either repair, and they have repaired my heart. They've actually reformed my heart. It's still enlarged, but they've actually reformed it so much. Or replace the tricuspid valve. This ensures no backflow or blood through the atria. So I did have a pig's valve put in at the age of 5, but now I do have a mechanical heart valve in the tricuspid area. So this is why I take what's known as Coumadin. It's a blood thinner to prevent a clot from forming onto the valve that sticks. And again, like I was reading, cause stroke or brain hemorrhage, etc. I also take a baby aspirin. But I have to be very careful too, because blood thinners means I can't stop bleeding when I get cut. So I have to be really, really careful during all this. Let's see. Surgery can help to repair right ventricle counterparts too. This person really cannot type, I don't think. Unrhythmic heartbeats can also be corrected during the surgery by getting rid of the muscle that causes the strain. So I've had atrial flutter. I had that 2 years ago? Yeah, 2013. I am on medication now for it, but I also had to have what's known as a cardioversion, where they had to take the paddles and shock my heart. The outcome of this condition will depend on how early the symptoms and signs occur. So the earlier, the better. So thankfully, I was showing symptoms right away at birth. If I wasn't showing it at birth, who knows when I would have shown them, if any, and who knows what my outcome would have been today. This is dependent on how the valve is leaking. And again, mine was so severe, it was showing right away. It's estimated that for those young children who receive diagnosis at a tender age of about 1 year, the results turn out to be good. So I was diagnosed when I was like 24 hours old, but my treatment, surgery, nothing could be medically done until I was 5, if I had survived that long. So just shy of my 6th birthday in July 1996, I had, it's called a porcine valve, but it's also a pig's valve, implanted. And it was supposed to give me approximately, I think, 10 to 20 years, if I remember correctly. So basically about this time right now in my life would have been the time where I needed a replacement. But around age 12, I started having troubles with breathing, walking down the sidewalk, all that kind of stuff. So we knew we were getting to, sorry, my dog's barking, the point where we're probably going to need a replacement sooner than later. So in October of 2002, I had an angioplasty done. We were trying to buy time to prevent having another surgery. What an angioplasty is, it's just like a catheterization. They go up through your groin area and they blow up your valve almost like a balloon, hoping to, buy time, wait, trying to give me at least another year or so before they had to put a valve in. But unfortunately that failed. So 2 days after Christmas, December 27th, 2002, was when I had my valve replacement, and they put in a mechanical valve. And I was 12, so I was still a child, but they didn't want to put in a child-size valve because that would have meant I would have needed another surgery to replace that valve to have an adult one put in. So they just put in the adult one right away. And this one is supposed to last me a lifetime. I've had issues already with clotting, where I actually have almost lost it about 3 times already. But shortly after that surgery, I developed an infection, very deadly infection, Pseudomonas, and on top of Pseudomonas, I had staph and one other one that I cannot remember off the top of my head. And usually people do not survive with a Pseudomonas infection, and I had that for 5 hard years. My cardiac surgeon, every time she would open me up, according to her words that I've heard from my doctor, she would be swearing like a sailor in that operating room because I would just be covered in it. So it was 5 years of surgery after surgery, treatment after treatment to try to get rid of this infection. And I explained in a previous video of what the cause was. And I've gone to the point where I've been without my pacemaker. I do have a pacemaker as well because after that surgery, my valve replacement surgery, I got permanent heart block. So I do have a pacemaker. I am on my 6th one. I had 4 fail on me because they were infected. My 5th one I had for almost 10 years. I had that, my 6th one put in 3 years ago. It'll be 3, it's been 3 years? Yeah, it'll be 4 years this year. Sorry, my dog is barking. I don't mean for her to bark in this video. But I had that done in 2012. I've had my pacemaker leads break on me to where I've gone into heart failure. So I have a lot of leads inside me that are broken. But I don't want to go into too much detail, but I've described in previous videos. You can go back and look. It's called My Story of Living with CHD. But I've had like three cardiac arrests on the operating table. I've actually gotten to the point where I saw the white light and I was just about to enter into heaven. I was about to go home. And, they managed to get me back. And I was quite upset. I literally asked them, why didn't you just let me go? I'm ready to go home. I was 16 at the time, and that, I'd gone through over 20 surgeries at that point. And, I was tired. But 2007 was the year that my pacemaker lead, it was an abandoned pacemaker lead that was infected, was removed. And that was the surgery that saved my life. So the reason why I am making this video today that you are watching is because of that surgery. If it had not been for this amazing cardiac surgeon, and if you're watching, I truly thank you from the bottom of my heart. You saved my life. I don't mean to get teary-eyed, but if it had not been for his amazing staff wanting to take my case, who was like the only one to take my case. I think there was 5 hospitals that we got sent to, and everyone rejected me except for one down in Milwaukee, Wisconsin. So, I mean, I'm just truly blessed for God to have blessed me with this amazing cardiac surgeon. He's the best in the world. Honestly, the best in the world, and his team, and coming up with the best game plan to remove the wire through my back, the safest route possible. Thank you for saving my life. Since that day, I have been living a phenomenal life. I've had a few more surgeries since then. I had that surgery on my pacemaker in 2012, a new lead put in 2012. I had surgery on non-heart related on my foot in 2014. I had surgery on my mouth last September. So I've had 25 total surgeries. 23 have all been heart or pacemaker related. But I mean, life has been great since 2007. I've done things that I thought I would never happen before. So if anyone's watching this, I hope you just get a little bit of insight of what a congenital heart defect is. And my goal is to inspire somebody with my story and letting you know it is okay. And if you are one of those few people, those 1 in 100 who have a congenital heart defect and have survived, you're a blessing, you're a miracle, and never give up. Never give up. There are times in my life where I have wanted to give up. But I have to just remind myself, you know what, I've gone this far, just keep going. I see my cardiologist yearly. Over the past few years, my heart has gotten weaker in time. That is expected with my defect. That is expected in an Epstein's patient. I have been shown very early warning signs of heart failure. So that is creeping up on me that at some point in the possible near future, I will have heart failure. That is something that's a little hard to comprehend and soak in. But, I've always known that it will happen in time. So I just live each day like it's my last, because each day I wake up with the severity of the defect I have is a blessing. I mean, I wasn't even given 48 hours to live. So to be here at almost age 26, I am truly thankful for. And I thank everyone that has followed me through my journey. I thank everyone from the bottom of my heart who has brought me, who has let me be a part of their life. So again, I'm probably just rambling now. Just want to say thank you. And for February, I hope and wish that this touches somebody and gives a little bit of information about CHD. And I just want to spread awareness. So if you could share this video with anybody you can, and let's spread as much awareness as we can. And remember to wear red during the week of February 7th through the 14th, and I will keep you updated on what day that is. I'm sorry in advance for all my posts that I'm going to be doing in February, but, CHD Awareness Month is very important to me, and I am a 1 in 100 patient who was born with a CHD. I am one of those lucky people that have seen adulthood. And I truly, truly am just thankful to be here. I'm thankful for the amazing medical technology we have. So please spread awareness for CHD awareness. Thank you.